From Shield Studio 22A, this is the Safety Synergy Podcast. Our host today is not me. No, I'm more of a mere facilitator today. Our host today is Paige Laratonda. Paige is a certified safety professional and environmental health and safety coordinator here at Penn State. She provides EHS services to a variety of units here at the university, one of them being the College of Agricultural Sciences, which is the connection to our esteemed guests. Our guest today is Dr. Florence Becot. Dr. Florence Becot is a rural sociologist and the nationwide insurance early career professor at Pennsylvania State University. She also leads the Penn State Agricultural Safety and Health ASH program, focusing on understanding and supporting agricultural communities with an emphasis on health, safety, well-being, and economic viability. Students are an integral part of her program. She teaches safety and health in agricultural and renewable industries every year to undergraduate students. She is currently mentoring 3 graduate students on their research projects. And with the ASH team, she recently taught lawnmower safety and farm incident preparedness to 200 middle school and high school students. Becot received her BS from the University of Rennes in France, MS from the University of Vermont, and PhD from The Ohio State University. So welcome. Thanks again. Just a reminder, our audience is safety professionals working across universities that might tune in to learn and have an interest in this conversation. Thanks for setting it up, Paige. I know we have some questions to kind of ask or guide the conversation, but again, it'll just be kind of a convo. So feel free to not worry about the script too much and have fun. But did you have something in mind that you wanted to ask Florence to start with?
Yeah, I just want to thank you for being here.
Thank you,
Paige.
Paige.
Appreciate it. Enjoy working with you. So Elliot mentioned your Ag Safety and Health program here at Penn State. Do you want to kind of give us a background on that or go into more detail on what that program is?
Yeah, I'd be happy to. So the Ag Safety and Health program was formally established at Penn State in 1976. So we're turning 50 this year. About June is when my predecessor was hired. We are a program that does research, teaching, and extension around the mission of supporting health and safety in agriculture, reducing illnesses, injuries, and fatalities, as it's one of the most dangerous occupations. So we do that. We have about 2 full-time staff on the team. We have 2 part-time staff, and we also have students who get involved in different parts of the program.
Very nice. Yeah, so the Ag Safety and Health program at Penn State is kind of a separate entity from environmental health and safety. As Elliot said, I do, kind of help out with the College of Agricultural Sciences. So they are different, but we do collaborate here and there. So it's always fun to do that. So how else do you currently serve the Penn State community as it relates to safety and health?
Yeah, it's an interesting question, right? Because you're right. There are different entities at Penn State who are already doing safety and health as part of their job, right? There is you, there is Casey in the College of Ag. But we do interact in the sense that we help with some of the training. So, for example, there is the training for the Penn State Farms that's happening this week or next, right? And Justin from my team is going to go help with that training. There's also interactions too. For example, we're getting a lot of demands for equipment operation. So this is from folks in the ag community, right? I should have said that the Penn State Ag Safety and Health program is more of the public-facing program that serves the Commonwealth. And also folks in the region versus EHS, for example, I will say is more of an internal program that serves the Penn State community. But a lot of the things that we do overlap, right? Equipment and machinery safety is integral both on the Penn State farms, but also for our community. So as we're working on redesigning a program that we used to have years ago, we've been talking with you, Paige, around what does Penn State do on the farms, and can we collaborate? Can we pilot our program with your students, with our Penn State students? And also, when I teach my class, it's been wonderful to bring you in as a safety professional. And for the students to learn about what it's like to be a safety professional, not just for agriculture, but also in different industries. Elliot, I will invite you to, but you teach class at the same time than I do. Right. So there you go. But I think it's always thinking about how can we support one another, right? As our resources can sometimes be limited or not, but it's, I do believe in teamwork teamwork makes the dream work. And so,
Right.
so that's how I approach, our work with EHS and drawing from your expertise.
Can you give us an example of some outreach work?
So the most recent example is on Penn State campus. There was the 4-H science camps. And for folks who are not familiar with 4-H, this is a youth educational program through Extension. A lot of it is focused around agriculture. They had about 200 youth between the ages of 13 and 18 that came to campus for a lot of different workshops, some related to dairy health, dairy sciences, some related to livestock health. And we were asked to do programming on safety. So we did a couple of things. On the Friday night, we did a lawnmower demo. That was the part that, Elliot, you read in my bio, where this is an example, too, of outreach, education, and research meet. We had a project last year that was funded by the College of Ag, where I work with one of my engineering colleagues on retrofitting a riding lawnmower because there are a lot of injuries related to lawnmowers. And what my colleague did, Dr. Manu, saying, as the engineer, retrofitted the engineer with AI vision shut-off cameras, which are not so different from cars, right? And so we use that demonstration on the lawnmower not only for the purpose of science, how can we make equipment safer working with industry, but also we use that as an opportunity in that training for 4-H to talk about, hey, like this is what you could do if you were to come to Penn State. So a bit of like promoting our own department. And also as part of that demonstration, we had a whole piece around if you're going to mow the lawn, these are the PPEs that you should wear. These are the things that you need to know about stability. And then the next day, and then that night too, we had a 2-hour slot. We did, with my other colleague, John, we did the Farm Incidents Preparedness Program. This is a program that runs for 60 minutes or 90 minutes where we talk through about, hey, you're the first on the scene of an incident. What do you do as a family member, as a farm worker, to not make it worse for the victim, not hurt yourself, and effectively call first responders. And this is an example, too, of a program that we're redeploying this year with a lot of success. We've had a lot of demands. We've trained 90 high school teachers, ag high school teachers, to deliver that program as well. And then as an example of outreach that we do, the next day around that 4-H is a good example. Justin was on the Penn State dairy farm and did a farm safety walkthrough with youth. And from that, he used more the perspective of, hey, you're working on the farm of your parents, of family members. How do you look out for hazards? And we drew on the material from what I teach my students, my undergrads, around what are the categories of hazards you need to be worried about. And then they were introduced to the hierarchy of control. How do you think about addressing those hazards? All of that while they were walking around and checking out the cows.
The safety professionals love to hear the hierarchy of controls
Yeah, it's our
being
favorite
referenced.
buzzword.
I like it because it makes my job easier.
So speaking of safety professionals and us three being advocates of safety and health, so Elliot and I have kind of a different background than you. We have an education in safety. But, your background is a little bit different. So can you describe how being a sociologist by trade helps in you and your role as a safety and health advocate?
Different background is kind of like the understatement of the week. Yes, I have done trainings over the years around agromedicine, occupational safety and health. But yes, my PhD is in rural sociology. My master's is in applied economics and community development. And you might wonder, like, why on earth? What do you bring to the table?
Or just how you found it overall.
Well, yeah, so it all started with my interest in research, what I was researching, which is farm communities, farm families, and their well-being. And really, how do people make it in agriculture, and how do we think about quality of life, and how quality of life factors in economic viability and the future of the agricultural workforce. And so I was doing my research on healthcare, health insurance, how do people access it, how do people use it, and then really where things took a turn towards safety, and I mean in the good ways, is that my first position after my PhD was not at a university, actually. It was at a CDC NIOSH funded center, and it was it's a bit of a complicated thing, but it was at the National Farm Medicine Center, which is in Wisconsin. It's a research center that is embedded in a rural healthcare system. And also as part of the National Farm Medicine Center, there's a National Children for their name. I was there for years and I still can't say their names. But it's the only CDC NIOSH funded center that is focused on the safety and health of children in agriculture. Why does NIOSH care about children? Because NIOSH tends to be about workers, right? NIOSH cares about children in agriculture, both because you have children working, but also because in agriculture, home and work overlap. And so children are often with their parents, even if they're not working. And we know that we see higher rates of injuries and fatalities among those children because of the dangerous nature of the work site, even if they're working. So it is when I joined the National Farm Medicine Center that I really started doing more research on safety beyond health and really learning more about occupational safety, but from a sociological standpoint. And really from the perspective of how do we convince people to do the safe thing. But as a sociologist, is it people that need to be convinced, or is the system not lending itself for people to be safer? For folks who are not familiar with sociology, as sociologists, we study society. We study how people have access to resources. We study how cultures, structures shape what people do in their day-to-day. And as sociologists, we really tend to pay a lot of attention to what is in people's environment and how does it impact what they do. Who's got the money, who doesn't have it, who's vulnerable, how is not vulnerable on the basis of their age, on the basis of their sex and gender, on the basis of their income. And so that lens actually comes into play really nicely in agriculture because when you look at the agricultural work site, you get, it's a very, family-oriented business, but at the same time, people are constrained by commodity prices that they don't choose. People are constrained by the weather. People are constrained by what equipment do they have access to or can they afford. And so, of course, we can always do better and be better for ourselves and with what we do. But once you start using the sociological lens, you're like, well, what could we tweak at a higher level so that we don't have these injuries and fatalities?
Absolutely. Well said.
Why in the ag industry is there such a different lens that we need to look through about like family farms, right? And as you mentioned, like families working together and versus, in almost all other industries or types of employment, it's kind of like big business. You know what I mean? Like
Well, there are people who've written their dissertations on that question. We don't have time for that today.
Very true.
But I think, when you look at agriculture, right, there's so many layers. There's a whole line of research that has looked at why do we still have so many family farms in the midst of, why essentially hasn't big business come in?
Exactly.
It has to some extent. It has in the input side of thing and upward and downward of the supply chain. It has, absolutely. But what we know is, when we look at farm families and how that intersects with what's happening in terms of safety, health, and well-being, right? And why is agriculture different than, let's say, a university where people come for their 40-hour work day, they do their job, they leave. If they're being, there are structures in place that are driven in part by OSHA. They're driven by the university. And at some point, if folks are not following these rules, I will assume they're going to be let go. It's much harder if you work on a family business, first on a smaller scale operation where there is that exemption under 10 workers in agriculture. I mean, the definition is more technical, right? But I don't remember the percent of farms that fall under that exemption, but it's most of them. It's many of them. When you're working with family members too, when you have a farm that is of multiple generations, there's that sense that people will do whatever it takes to keep the farm going. And so there's that aspect, too, of people are working really hard to keep that going. But there's also the family dynamics, right? There is those dynamics of, like, multiple generations.
Yeah.
And also, like, you're not going to fire grandpa when he's yet again doing something that's unsafe, or when grandpa can't see anymore very well as he's driving the tractor. So you just have like all these different dimensions too that you have to consider too on the farm.
Absolutely. And a lot of those challenges do carry over into the Penn State farms as well, and maybe other farms, across the university, at universities. So absolutely, well said. I think you hit the nail on the head with the just pressure of family tradition and keeping the family farm alive. And of course, that doesn't really exist here or at a workplace. But yeah, very good note. So I do have to ask and remind me, did you grow up on a farm, or did you have any exposure to that growing up?
Yeah, I had a lot of exposures in a lot of ways. I was like, how did I not get hurt? So my both of my parents grew up on farms in rural France. And actually, my mom's dad worked on my dad's parents' farms. Their farm was slightly larger. My parents had known each other their entire lives. Even if at the time you had the boys' school and the girls' school, they went to the same church. So they've known each other for their entire lives. Both on my mom's side, her brother is the one who took over the farm. And then on my dad's side, one of his siblings married a farmer. So I was on farms all the time on weekends. In the summer, we had to go visit so many barns. I was so bored. I remember as a kid being like, again,
Bored.
we have to go to a barn again, or this guy's farm again, because it was very rural, right? There were farms everywhere. And I remember, folks will be talking about what the harvest is looking like, what's the new piece of equipment that they had. And again, I thought it was boring. And so it's really interesting now to have this career where I love going on farms. I love the farm tours. I love seeing what people are doing. So it's interesting how these things as kids and how we change and evolve over time.
Through a different lens now, for sure. So I have to know, how does safety on the farm differ from the United States to where you grew up? If at all, maybe there are no differences.
From my understanding, so I communicate a lot with colleagues in Europe who have a very large project on safety in agriculture. Some of their OSHA rules are stricter. There are exemptions, but some of the rules are stricter on farms, so that does color things. In terms of equipment too, you cannot have a tractor without ROPS, I think. So there are some regulations too around what type of equipment are available or not available. And then there are kind of those softer rules or those softer things. So one of my area of research is childcare for farm families, and how childcare is both connected to farm children safety as well as farm business viability. In the U.S., as you may know, childcare can be very expensive unless you have family members to take care of it for you. It can be hard to find as well if you live in rural areas. In France, which is where I grew up, where first of all, school for children starts when they're 2.5 or 3, so you don't have them around on the farm as long. So you already have kind of like that quote childcare built in once they are 2.5 or 3, which in the U.S. is not till 5 or 6. Right. So that's a big difference. And this is when it is most dangerous for the children because they're highly mobile, but they're not necessarily good at following rules. Yes. It is their level of development. And then also in France, as well as in many European countries, there's much more of a childcare infrastructure. My mom was actually a childcare provider her entire career, where it's much more affordable to pay for childcare. And so that sense of children getting hurt on farms, we see, my sense is there is less of it in those other countries, and it might be the confluence of all these different factors of what supports are in place. Because I've talked to so many farmers in the U.S., there are some where like we will never use childcare. We want to raise the kids on farm, which is, it's their children. And there are so many who said, the kids would be much less on the farm if childcare was available or affordable. And so it's kind of some of those differences, right? Same with access to health insurance and healthcare. Very different here versus Europe.
Very good point. Of course, the farmers here at Penn State don't bring their children to work, or at least that I'm aware of. So that helps out on that end.
Bring your kids to work day.
That's
Didn't
true.
they have
There is
recently?
one day allotted
One day
a year for that.
Yep.
Yeah. So I guess I'll ask you, and I'll think of an answer myself, but what do you think is the biggest challenge when it comes to ag safety and health on the farm?
So based on the research, both that I have done, as well as the research of colleagues, money and time. I think that when we think about outreach around safety, often goes to that knowledge remediation and behavior change of like, well, if only people were safer. What I find is that when I interact with farmers, they know that their occupation is dangerous. Like many people in agriculture, most people in agriculture know someone in their community, in their family, who's been gravely hurt or has died as a result of an incident on the farm. That work of raising awareness, we're beyond it. Like folks know the technical side of things, the more technical or the emerging issues around, hey, this is an issue we don't have 5 years ago, but we're seeing it as a problem. That is where that awareness, knowledge remediation is important. But what we hear in our program through my research, it's money and time, is like people will make upgrades on the farm if it wasn't so expensive. Would put that ROPS on the tractor if it wasn't so expensive or if they had the time. And that comes up again and again and again. But it's one area where we don't have a lot of support.
Absolutely, I would agree with that.
If there was an imaginary money pit and it was bottomless, what kind of difference do you think that would make up?
Well, that's a really hard one to answer because farms are so complex, right? There's such complex operations. I'm sure you see it at Penn State, right? And even you go to the dairy farm and then next you go to the beef farm. And so there are things too. And when you look at the hierarchy of control, right? What are the changes that need to happen? Is it your piece of equipment? Is it your manure pit, which by design is dangerous because of the way it is? So I think it's a really hard one to answer, but to give you a sense that there is that desire, that there are people who want that kind of support is the ROPS rebate program. So this is rollover protection structures that we put on tractors. Depending on the type of tractor you have, they cost anything from $700 to $3,000. The National Tractor Safety Coalition, which is based out of New York State, has been coordinating a ROPS rebate program at the national level for several years. Until recently, Pennsylvania was part of it. We ran out of money last year. Tried really hard to get more, could not work, was not able to at the time. But in Pennsylvania, we have had a wait list of about 130 farmers on that wait list for the ROPS rebate program. And we have been consistently the second or in the top 5 of states with the highest wait list. And so that does give you an indication that people are interested. Years ago, when I was doing focus groups with women and talking to them about how do you keep the children safe, first of all, they are so creative. You safety professionals will be opposed to some of the things that what they do, but it is that relational approach of like having the kid with me in the closed cab is safer than having the kid running around under my wheel. So it's that very relational thing, right? Are there vibrations in tractors? Yes. Is it loud? Yes. Could they fall off? Yes. But for those folks at that point in time, it is safer.
You have to weigh the risk.
Yeah, the way the risk. I don't remember where I was going, but where I was going with this is one of the farmer talked about, isn't it interesting that you can get money from the USDA for fencing to move your ship around for grazing purposes, but there is absolutely no funding for fencing to keep the kids away from the most dangerous things. And this is the story over and over again. When you look at how much money, I'm sure you get frustrated a lot, but you look at how much money is spent on making sure the animals are healthy and happy, which is important, right? Making sure the water is clean, which is important. Making sure that the soil are healthy, also important. But when it comes to the people who steward the soil, the animal, the land, there is a cliff. Like there is like, what do people do? And so I think it's a very telling story too around how do we prioritize as a society what is most important.
Yes, I agree. And farms are just so diverse. Pretty much any hazard you can think of, you're bound to find it on some farm, if not one, the other. You know, we have like machinery, confined spaces, toxic gases, chemicals, you know, equipment, farm machinery, pesticides, you know, you name it, the hazard exists. So
psychosocial.
Yep, absolutely, absolutely. So just finding ways to manage those risks and, you know, prioritize, like you said. But yeah, I mean, I think another challenge too is a lot of the workers that we have here at Penn State have farms of their own at home. So, you know, they don't have to really follow a lot of the same expectations at home as they do here. So it's kind of figuring out how we can make sure that they're, you know, even taking maybe what they learn at work and applying that to home as well for the safety of their own farm.
Yeah. But I think it's interesting, right? Because we often approach safety and health from a deficit perspective of like people are not doing this or they should be doing better. But I always think about farms and how much could go wrong. And I don't know if it's a popular opinion or perspective, but I'm like, the agricultural sector is doing well. Considering how, I mean, you just talked through the different hazards is, you know, those people do have systems in place. Like, do they have the training every year like OSHA requires us to do? Or, you know, those little very like prescriptive, maybe not. But it's always interesting when we do outreach, we have this farm hazard hunt, which is it's a mini farm. It's a model farm, and it has 52 different hazards on it. We've been driving the hazard hunt around the state for 20 years. It's so popular. It's always interesting when we are at some events and parents come with their children, and they don't need us. They are like, okay, what do you see? What should we do? What do we not do? And so a lot of that teaching is happening. It has to happen. And so I think, too, is how do we look at it maybe from not a deficit perspective, but more from like look at all the things that people are already doing in a very complex environment. I think, too, like that's something that we don't do enough of. We tend to be, I mean, all of us in our lives, right? What could I do better? And it's like, well, let's chill for a minute and look about all the things that people are already doing. I would say that in my class in the spring, it's interesting because some of my students are from farm backgrounds. They live on farms or they work on farms. And one of the things that I have them work on is an occupational health and safety management plan. And it's a scaffolded assignment where they work on different parts during the semester. And I like asking them at the end of the semester, like, do you think that your folks are going to want to use it? Like, how do you think? And so I've had like the variations of like, yeah, I've talked to my parents about it and they were interested. We're going to look at it. To like this year, one student saying, apparently his dad said, will that help if I got hurt? Like, so I think you have like, I think you have the full spectrum, right? You have the folks who will never change their ways. I mean, all parts of society, right? And you have folks who are like, yeah, what could we do better? And kind of like incremental changes.
Any other tips? This is something I jotted down. So we talked about the challenges, right? The time, the money, the tradition. And so my question is like, well, how do you win this battle?
Yeah, and I think, you know, I like to look at the work that the colleagues out in Ireland have been doing. They're kind of my role model. There are a couple of programs that I see as doing things that are really exciting and important. The Irish model really uses the farmers as expert model and the peer-to-peer learning model, where they do discussion groups. And those discussion groups are not only about ag safety and health, they're about different parts of operating a farm. So 1 week or 1 month, they might talk about ration management for the animals, and 1 month they might talk about safety and health. But it's really, my understanding of how it works is it's really about the group coming together and bringing to the table what issues they have and talking about them. The downsides, though, is who's the facilitator of that group and what happens when some of the recommendations are really bad ones, because there are some, right? So how do you bring the group back together in a discussion around, like, is that really the way we want to go about this one? In a way that's respectful, in a way that's not going to shut down people. So I think, like, how do we work with people as experts and not as people who need to receive yet one more layer of information, but recognize, like, you know, what they do? it's easier said than done, because when we are asked, so often we are asked to, we get 20 minutes, and it's like, hey, come for 20 minutes and talk about this particular safety aspect. Well, and then everyone is sitting in the room like this, looking at you, and you're the last thing before lunch.
Yep.
That's a really good point. You know, it's tough to have, you know, this overload of information, and then safety is just a separate topic that we try to discuss at some point when we have time, right? Where if you actually try to integrate safety into all of the other important topics that they already are discussing, that to me is a winning approach right there. So
Yeah, you know, the students got really excited. So in my class this year and last year, we had this panel of experts, and Paige, you were one of those. And basically what I do is I invite 4 to 5 professionals to come talk about what does occupational health and safety look like. And the panel includes people who safety is their job, like you, Paige, and Greg, and other folks who like, oh yeah, I guess I never think about it. But one of the speakers this year from CNH, which is a big equipment manufacturer that has a location here in Pennsylvania, in New Holland, talked about, I think it was the safety minute or 30
like
seconds.
a toolbox talk.
Yeah.
Approach.
So many of my students grabbed onto it and incorporated it as part of their safety plans for the training component, and really like that idea of it's not the thing that we do once a year, but it's like once in a while on a regular basis is just part of what we talk about.
That's wonderful.
Yeah, and some of the extension teams at Penn State do that, right? Either they would invite us as part of an event they're putting together, and they're like, we want to integrate safety, or they would say, hey, do you have 2 or 3 slides that I can add to my talk? So we have, and Linda from the team is the one who's really been doing that work, where, you know, it would be like something, right? It's the agronomy team. They're talking about getting your tractor ready and for seedling, and then they'd be like, okay, safety just gets incorporated in it, and no one bats an eye. Move on to the next thing.
Yeah, I'll have to look more into that Irish model.
I love the Irish model. And they have the coolest simulators as well. So that's something that Penn State does not have. But so in Ireland, they have in the Republic of Ireland, they have a network of agricultural colleges. So a bit like Penn State with like the satellite campuses, and then they have those simulators. They have horse simulators, so like to learn how to like dismount. Like this was interesting, but they also have one that is about like the different pieces of equipment. So I got to try it, and you're like driving the combine. So you have like the you know, the screens in the front, the screens in the back, and that's what they're using to teach students before they go on the actual pieces of equipment. There are some that are very comfortable from the get-go, but some that are not. I thought that was really neat. I mean, those are expensive pieces of equipment, but...
Are there any other examples that you guys utilize of maybe advanced technologies or fun toys to teach?
Yeah. So in the team, so Linda, my colleague, is co-leads a network of extension educators in the Northeast who are interested in ag safety, but it's not necessarily part of their role. As extension educators around safety have kind of gone a ways over the past years for a lot of reasons. And they are going to, so every year they introduce a new demo or a new teaching tool as part of their coalition. And this year they are introducing VR goggles. So I haven't asked her in a bit how they're getting them ready. But yeah, that's what they were doing this year.
And I know you all have a fancy grain bin that, you know, is attached to a trailer that you take to different safety days and trainings. So can you kind of expand on that one?
Yeah, so that's a cool story. My predecessor, it was back in 1997, I think, that long ago. But it's basically a grain bin trailer, a mini grain bin on a trailer. That we use for, in particular, trainings with first responders. And the core story, this was built, the Department of Agriculture and Biological Engineering, and our engineering students have to do a capstone as part of their degree. This grain bin trailer was built with students for over a couple, 2-3 years of capstone projects. Since I started my role about 2.5 years, I've been contacted with 2 of those previous students, and both work in the ag industry and wanted to bring the trailer to an event that they were organizing. And most recently, one of them sponsored a training for first responders so that first responders could get trained in how do you respond to an incident in a grain bin at no cost. And so anytime I get an alum calling, I'm like, anything you want. And we have some evidence, like impact, right? How do we measure the impact of our work related to safety and health, right? We're making impact when no one's getting hurt, but it's hard to know that, right? But we do have a couple of evidence of data points where farmers were rescued from a grain bin, and the first responders had taken the training through us and said we were able to know how to respond effectively because we had gone through that training. And so that's really, really exciting.
And I guess to paint a picture, so this grain bin on the trailer, I believe it's been a while since I've seen it, but it has like a plexiglass or a see-through section cut out so you can kind of see and visualize, like simulate an entrapment in corn or grain.
I was talking about something totally different.
Oh, interesting. Okay.
I was talking about our big trailer that goes out and that fits like 250, 300 bushels of corn where you can have like 3 or 5 people in it at a time. For those trainings with the Great Walls of Rescue, which that's the piece of equipment where you build literally a tube around the person and then you aspirate the grain out. Yeah, so this is a very small, the one you're talking about is basically a stock pot that was cut in half. And then there's a piece of plexiglass. And then, yes, we use it to show, and there's like a little trap. And then the grain starts flowing and we have a mini person and we show how quickly someone can get engulfed.
Both great learning tools. That's entrapment.
Yeah.
Yeah. So with that said, I mean, we collaborate a little bit, EHS and Ag Safety and Health, at Penn State. In what ways, I guess, can you see us maybe collaborating in the future, or how can we, integrate some of those nice, innovative things that you've come up with in your group with EHS and the farms at Penn State?
Yeah. I mean, I think it's like, because we are dealing with the same hazards, right? What are programs that we have that work well? And can we, maybe the ASH program has something that gets used with the students on the farm, or maybe you have particular processes or programs that you use with the students that work well that we can use maybe for young and beginning farmers. I think it's that kind of thing, right? What are the different programs? One that we know there's a lot of concerns around are gases, dangerous gases on the farm, cytogases, in particular manure gases. What does programming look like around that? We've been stumped a little bit on demonstration to help with that aspect. But yeah, I think it's like, how do we, I'm a big proponent for not reinventing the wheel. So how do we support one another and say like, hey, we have this program, we could adapt it for the Penn State farms, or vice versa, we could adapt it to other things. I think there's also great opportunities to do, and I think we've talked about this before, right? Because Penn State has farms in different parts of the state. Can we do farm safety days on those farms? And where it's beneficial both for the employees on the farm, the students, but also the surrounding community. We're actually working with colleagues, collaborating with another college in the state that has a farm, and that's exactly what we're doing around biomass and confined space safety. So, yeah, I think how do we support one another and make each other's life easier?
Right. Yeah, we have the same motive, the same mission is keeping people safe on the farms. If you were given $1 million, what would you do with it to, related to the betterment of safety and health, of course?
Yeah, I love that question. And I'm going to pull a Greg, who was one of the panelists in my class not long ago, and said $1 million is not enough. So I'm going to say, well, I want to.
That's very true these days.
I think about that a lot. And I think about that around, from a research perspective. I could say like $1 million would be awesome to do more research around safety and health. And it's something that I talk a lot with my colleagues is a lot of we've already established an insane amount of knowledge around safety and health and what could make it better. One of the challenges that we face is people who can do something about it are not necessarily doing something about it. So I'm being a bit cryptic here. But is it using the $1 million? So I would have to quit my university job, which I have no intention of doing. But is it using that $1 million to lobby and say, okay, we have this thing, like do something with that knowledge that we have. But I'm going to be a lot more practical and think within the confine of my position, which I really like. And it is addressing that time and money issue. What can we do? And I'm going to use the example of what the Northeast Center for Occupational Health and Safety does. They do work around agriculture, fishing, and forestry. They're the CDC NIOSH-funded center for the Northeast, and they're also the New York Center. They have this wonderful program that's called the John May Fund, which is fabulous. Basically, it gives farmers seed money, farmers, fishers, foresters, seed money to address a problem that they have on their farm, or it's a cost share, I guess. They have a few different things. And basically what they do is once a farmer puts in an application, it's a pretty straightforward application from what I understand. They do a farm safety walkthrough and they say, yep, that sounds like a great idea. Sounds like that would address a big issue on your farm. Or they say, well, what about, okay, that could help, but we see this other problem that might be more urgent to address. And so then they work with the farmer to implement that change. And it's a very popular program from what I understand. They work with a lot of farmers. They get funding from the state of New York. And it's really one of those programs that addresses the practical aspect of things. They have another program that is really cool. It's kind of an incubation idea where they team farmers with folks who have expertise in design and commercialization, I think. And basically, a farmer or a fisherman or a forester can come and say, I have this idea for this thing that I want to do. And then they work with each other and design that piece of equipment that is supposed to be to make things safer. And so I think this also is that model of folks are their own experts in their lives at knowing what they need. And it's providing that practical support. But maybe first I would invest that $1 million to make it grow. Yeah. And then...
Talking like a businesswoman now.
Well, I put it in the bank, invest it, and then I would draw the proceeds so that we can indefinitely do that kind of thing.
Wow, you have put a lot of thought into this.
Not that much.
Very good.
But I was like, if I ask that question, I better have an answer.
How are we trying to target any rash of unfortunate events or in this incidents in that industry? What comes to mind about focus areas?
Yeah, so the our program has been doing injury surveillance for over 40 years, if not 50. So I have access to these decades of data from my predecessor, and it's something that I started my role. I do as well, where every year we put out the report on farm fatalities in Pennsylvania. I just put it out within the last month. It absolutely drives our programming. And there's also something else that drives our programming, which is our strategic planning process that we do at Penn State Extension, that every team must do every 3 to 4 years around what are the needs of the community, what are the priorities, how do you address them. So for us, from injury data, we know that equipment and machinery, number one, by far, rollovers is a big one. So we do historically, and being in the College of Ag and in the Department of Engineering, Ag Engineering, so historically we've had that emphasis on equipment and machineries. One program that we started, thanks to funding from my department and then from Farm Credit, is we've been doing a giveaway, farm safety item giveaway program, because I'm like, do people need another pen or another hat?
Right.
Can we do something different? It costs a little more money, but we give out safety items. So SMVs, slow-moving vehicles, those are those triangles. Those go like hotcakes. Last year, what we started doing are PTO shield covers, recognizing that People lose limbs over it every year, if not worse. And so that driver's programming. One tricky one for us too is who gets hurt and who dies on Pennsylvania farms. We know, and our data, we're not very different from other states. It's older folks, 60s, 70s, 80s, and it's children. It's our youngest children. They're 0 to 9. In Pennsylvania, for folks who are not familiar with Pennsylvania, we have a very large plain community, Amish and Mennonite. Mm-hmm. And unfortunately, a lot of the children who die on farms in Pennsylvania are from these communities. Mm-hmm. So that involves doing work with these communities, but in a way that in ways that they're comfortable. And I know there is a lot of reticence, and it's a very tricky one to navigate. And there was a dad, I think, that was charged in the death of his child, like just recently. I think the news article came through my desk today. That happens on a regular basis. How do we work with communities that are more and more adapting equipments, larger equipments than they were in the past? This is a really hard one, as there are threats of cases against parents for child endangerment. I've been asked to testify in a court case. I was like, I cannot, wow. Because I need to be able to work with the community. It's a hard one. We are fortunate to have collaborations with plain communities and different interactions where they will use some of our demonstrations for events that they organize, or they invite us.
I think another thing that came to mind, right, as far as tips or tricks for folks, safety professionals at universities that interact with the ag community, is focusing more on like fundamentals over technicals, right?
The OSHA terminology.
Right. Yeah.
Yep. That's not going to bring you far.
Exactly. That's what I'm. Yeah.
Well, it's cryptic.
Mm-hmm. Yes.
Yeah. I mean, I think like any group, right? Like, what can you be straightforward about it and use language that everyone's going to understand? And I think too is one thing that I like to think about too is how do we provide support? There's like that tension between the stick versus carrot approach, right? Because in occupational safety and health, right, that's often what gets waived. OSHA is the stick. Is it, and really to me that comes down to that issue of children's safety on farm. I think it's like a really good example. You can tell parents all day long that their children should not be around on their tractor if there's not a grandparent to help, if there's not adequate and affordable childcare to relieve that pressure. People are stuck in situations where they do the best that they can. Folks are worried. That's been one aspect from my research that has come up is some of the research that I've done is do content analysis of looking at what do programs and resources for farmers look like, how are they worded, what pictures do they use, what's the content. So much of the material for children's safety is written around convincing parents they shouldn't do something and around educating them that something is dangerous. You see it in the language that's used. What I found in the research is that folks with young children are very aware of the dangers, and it's actually a big source of stress. Like, people talked about going to bed at night worried that their children could get hurt. I don't think we're helping if we are being naggy about things and not proposing alternatives to help people. And I think that's the hardest part of this job is we have a lot of knowledge and a lot of you shouldn't be doing this, but oftentimes the best we can offer, quote, quote, the best we can offer is a training. It's great for some folks. It has its place, absolutely. But in a lot of cases, it's like we're beyond this. And it's also that hierarchy of control, right? Training's towards the bottom.
Yep. Right. I would agree with that completely. It's not that people don't know what's unsafe.
Or don't care.
Yes, and they come with the intention of being safe. Of course, that's not, the plan. Their plan is to not get hurt that day or to cause someone to get hurt. So it's just providing them the resources. Wow.
I had one last misconception that comes to mind that I wanted to mention.
Go for it.
I feel like, and we've talked about this a lot, that some people have this idea that I work on a farm, therefore OSHA standards don't apply to me. right? Because we know that like the ag standards in OSHA have a pretty specific application. And this is where I think people confuse it, right? So those ag standards apply to ag operations. So those activities are directly or indirectly impacting the commodities and livestock, harvesting and growing and treating, watering and all that stuff. But there's lots of other activities that farms do. So just because you're a farm, some people think there's a disconnect from those OSHA general industry standards, but there's a lot more than, like I said, those specific ag operations that occur in a farm. And for those operations, those general industry standards do certainly apply.
Well, yeah, that's one that I don't hear people talk a whole lot, to be honest. And I think, I mean, OSHA there's a lot to it, right? The one that I talk a lot about with the students in class and with farmers when we can, but it's a tricky one, is that idea of exemption is not total. It's not a total exemption. If there is an incident on your farm, OSHA can come and do an investigation, no matter, I mean, if it's not a family member, right?
Right.
And so, and that's also what I talk about with the students too, and with the farmers, with caution is, if you know there is a hazard on your farm, like the kind that can kill someone, you need to be addressing it, because if later finds out in the investigation that you knew, that's going to be a problem. But I think it's tricky too with OSHA, because I feel like they're kind of the boogie people. Like they're, I mean, I feel bad for them, and you know they do their work out of care, right? But how do we make those rules and regulations easier to comprehend? Because I've looked at them and I'm like, serious? Like you're reading it 5 times and you're still not sure what that means. And I think it's the importance of working with OSHA. And I found out recently that they have folks who are doing outreach. Like their whole purpose is doing outreach. I don't know that. I found that recently, and I'm trying to bring one of them to a training we're organizing. But also it's working with lawyers. For example, at Penn State, we're so fortunate that we have the Penn State Ag and Shell Law Center, which has such a wealth of knowledge around agriculture and laws and regulations that apply to agriculture, and how do we demystifying, but also like decomplexify something that's super complicated.
Right.
I mean, even as safety professionals, I mean, we find ourselves reading standards over and over and over and over again just to think, okay, yesterday I thought this way, now I'm not sure. So we do find ourselves translating a lot of the regulations to...
And how do you do it in a way that people are not going to look at you and walk out of the door?
Exactly. Yep.
Awesome questions. Thanks for
Thank
both
you.
of you doing this.
I learned so much about you. We've been working together for a while, and I've just learned so much more. So really appreciate your time.